it's not just about helping the person with OCD and those symptoms. Really, it's about helping them live and live well, when the OCD is present. And so I find that ACT, it's also an exposure-based treatment, but it adds some of these other components that ERP doesn't.
Are you ready to break free from OCD? In this episode, I'm joined by Dr. Marisa Mazza, an expert in ACT and ERP and the author of the ACT workbook for OCD. Today, we discuss powerful tools to overcome OCD and anxiety. So let's get straight into it, and please do subscribe for more content like this.
Hi, Marisa. Welcome to the podcast.
Thank you so much. I'm excited to be here.
Yeah, it's great to have you on. So to start off with, could you give us a bit of background, please?
Sure. My name is Dr. Marisa Mazza. I'm a clinical psychologist licensed in California with a group practice called Choice Therapy, and I specialize in helping teens and adults who are struggling with OCD and other types of anxiety-based problems using different evidence-based strategies. And I think I found my way to this place, partially because of some of my own suffering, some of the suffering I've witnessed within my family. And I'm really excited to sort of be here and feeling very grateful for the work I do and the clients that I get to work with.
Yeah, fantastic. And one thing that you obviously specialize in, being the author of the ACT book for OCD and anxiety. Is that the correct title? Before I don't get that right.
Sure. It's called the ACT workbook for OCD.
Yeah.
And it's a self-help workbook integrating both ACT and ERP. So ACT stands for Acceptance and Commitment Therapy, ERP, Exposure and Response Prevention. And it basically takes the great stuff from each of those models and integrates them in order to help folks learn new ways of interacting with some of their difficult experiences, and how to be more present and focused on the things that are important to them in life.
Okay. And so what attracted you to start working with ACT? Because I think most OCD therapists, for example, obviously focus in on ERP, and that's obviously something that you're talking about that you do as well. But it seems that ACT is a really big part of the process for you as well.
Absolutely. So I had originally been trained in a very traditional exposure and response prevention model by Edna Foa and Dr. Ziadine back at UPenn. And I found that immensely helpful in really working with all sorts of anxieties. However, what I noticed is when using ERP as its own sort of model, I would notice for some folks, although OCD would improve, at the end of therapy, they would still say things like, I'm not really satisfied like in my career, or I'm not really satisfied in my relationships. There was kind of this overall like lacking in life. And I honestly had a little bit of exposure to ACT in my internship, but it wasn't until later on that I sort of stumbled upon a training by my mentor, Robin Walzer, who it was focused a little bit more on ACT for anxiety. And it was like a light bulb moment for me. It was about like, this is what was missing. It's not just about helping the person with OCD and those symptoms. Really, it's about helping them live and live well, when the OCD is present. And so I find that ACT, it's also an exposure-based treatment, but it adds some of these other components that ERP doesn't. For example, values exploration, specific cognitive tools, as well as a number of acceptance-based exercises to really help folks get to like the crux of the OCD, which is like avoidance and control. And so integrating both of these models, I think, just really help the whole person and focus much more on living.
Absolutely. Yeah. I think it's something that when I was really struggling ACT really attracted me for that reason, that it didn't just provide the bare basics of having to face your fears, or to learn how to to habituate to an obsession. Actually, it gives you scaffolding. It gives you a kind of framework by which to live your life, in a way that's more in line with your values, your goals, with the person that you want to be. And I think that's actually, as much as anything for me, that was really important to have that. Of course, I needed to kind of do that difficult exposure work as well. But like you say, you can actually do exposure using the ACT model, no?
Exactly. Exactly. Yeah, I think if you're doing exposures in more of an ACT model, um, I kind of would think of exposures in that way as being sort of a way of getting good at having your experiences while doing the things that are important to you.
Yeah.
So, for example, I was working with an older woman who really wanted to be able to travel across the country to see her grandchild, right?
Mm.
And so all of the exposures we did were in the service of her connecting with her grandchild,
Yeah.
or working with somebody with agoraphobia. We were welcoming in some of the grief and the anxiety in the service of her being able to like drive and explore and go on long distance hikes that she wanted to be able to go on.
Yeah.
Um, and so I find that it helps with motivation, right? Because
Mm.
doing exposures is really hard. And so
Yeah, absolutely.
why bother doing them unless it's for something really important? And getting clear on what that important thing is, I find is really, really helpful.
Yeah. Okay. That obviously brings us in line with the values there. But so in terms of doing exposure in more of the ACT model, is that kind of then looking at more of real life exposure in a way? So, obviously, if somebody is struggling with traveling across the country, then of course they would want then to start doing smaller exposures, no, like traveling to a town nearby and getting used to the discomfort of that. But actually, that could be something that they have to do in their day-to-day life that maybe they've been avoiding because of their OCD or because of their fears.
Absolutely. Absolutely. And I think in terms of like how to do the exposure, there could be many different ways of doing it. But in their day-to-day life, absolutely. If they're working with a therapist, I always recommend like starting out with by doing the exposures with your therapist. So
Yeah.
if you're able to do it with you in person, great. If not, maybe over the phone or through video. But absolutely taking small steps towards it. And I often talk about like exposures can be done in a compassionate and kind way.
Yeah.
They're not meant to be like super overwhelming. They're also not meant to be super easy. They're just meant to be challenging. And
Yeah.
so, in thinking about doing exposures that are based within an ACT framework, it's really about doing things that are challenging, that are hard. In the short term, it will bring up some discomfort, but it's always in the service of that long-term value.
Yeah, it's really interesting, isn't it? Because actually what you're talking about, if you do it in the right way, I guess, if you do it in a kind of mindful and compassionate way, it's actually an act of self-compassion to do something difficult. No, it's
Absolutely.
it's interesting because although it might give anxiety, it may not seem like it's a compassionate thing to do, but obviously in the long run, it can lead you to a much more positive place.
Absolutely, absolutely. Anxiety, OCD is all about short-term relief, right? Like, I got to do this compulsion. I got to do it now to reduce this anxiety, to control my situation. Whereas values is sort of the opposite in that, like, it's about most of the time, it's about long-term living.
Yeah.
And so, if we think about values of like love and kindness, sometimes it means in the short term doing things that are uncomfortable or difficult in the service of long-term love and
Mm.
compassion.
Yeah, absolutely. Yeah. Okay. And could you could you give us a bit more information about ACT? Could you unpack ACT a little bit? What are the kind of the cornerstones or the foundations of ACT, please?
Absolutely. So, if I were to just kind of in a few words describe what ACT kind of means to me, it's a willingness to experience whatever's showing up in the service of doing what's important to you. And it's made up of 6 core processes, and we often refer to this as the hexaflex. And so the first core process is acceptance. It's a willingness to experience uncomfortable sensations, uncomfortable thoughts. It's a willingness to also kind of be with the reality of what's going on around us, outside of us as well.
Yeah.
One of the other core processes is present moment. And we hear this a lot in some of the third wave psychotherapies. It's about mindfulness. It's about being here now, right? Noticing what's happening around us, noticing what's happening within us. The other core process is values, which we've we've spoken a bit about already. Values are what gives us a sense of purpose and meaning in life. They're sort of our guiding light, if you will, towards living a rich, purposeful life. And the next process is committed action, right? And so, sometimes we're aware of our values, but we're not really acting on them. And that's where committed action comes into place. It's like how much of our time is spent doing those things that are actually important to us, right? The other core process is called self as context. And this is really about sort of stepping back and recognizing we are not our experiences. We are not OCD. We are not anxiety, right? But that there's a part of us, the observer part of us, if you will, that can notice these different processes that we experience. And so it's about tapping into that noticer and noticing that there's a part of us that's bigger than any one experience. That at any point we can tap into that noticer. And there's different experiential exercises to help folks get a sense of what that feels like. And then lastly, there's cognitive diffusion. So when we think about the way our minds are set up, it's that we are automatically fused or kind of one with our thoughts. We automatically buy them, believe them. But what diffusion sort of teaches us is we can kind of notice when we're hooked or stuck on thoughts. And step back and say, like, is this a helpful process that I'm doing right now, right? Like, is getting hooked and focusing on these thoughts, is it helping me be present in my life? Is it moving me towards those values? And if it is, great, buy the thought, believe it, it's working for you, right? But if it's not, which is typically the case with obsessions, right? If one is overly focused on obsessions, it gets in the way of being present, right? It gets in the way of living one's values. So that would be a case where it's likely unhelpful. And cognitive diffusion teaches folks different ways of sort of unhooking from those thoughts, creating a little bit of distance between them and the thinking process. So that way they can choose, okay, what do I want to do next? I notice I'm hooked. Do I want to continue to spiral into those thoughts, or do I want to make another choice? Maybe do an exposure or focus on present moment or practice self-compassion.
Okay, fantastic. Thank you for that.
Absolutely.
No, it's really interesting. It's obviously self as context and diffusion are kind of very important things that I guess they work together. No, it's all of these things that the hexaflex that you're talking about. It doesn't seem like there's one element that's okay, you just need to do that and then ACT will work. No, it's like all of these components are working together to make it a successful modality for people.
Absolutely. And the context in which we are in also plays a role. Right. Sometimes rituals can be sort of an away behavior, we call it. Rituals can be sort of compulsive, right? And can be unhelpful. Um, Other times, some rituals can be helpful, right? Like thinking about some helpful rituals in the morning to help us be grounded and more peaceful throughout our day, or some nighttime rituals. But again, depending on the context and in which what is driving the rituals, some may be more helpful and others not. And so that's the other thing about ACT is not only are we are these sort of processes interacting with one another all the time, there's overlap between them, they interact with each other, and they also interact with the context in which we are in, um, as well as considering the function of the behavior, right? And so the example that I gave before is something like rituals. Oftentimes OCD rituals are referred to, as compulsions. They're a means of avoidance and control. However, I've also seen some helpful rituals, like for example, creating like a nighttime routine that helps us, wind down, or a morning
Yeah.
ritual that helps us be more grounded and peaceful throughout the day.
Yeah.
But that considers like what's the function, what's driving our behaviors? Are they helpful? In some contexts, they may be more helpful than others. And it uses all six of those core processes to really foster a psychological flexibility. So, psychological flexibility is positively correlated with overall happiness and satisfaction, and which is kind of the opposite of OCD, which is very rigid, right? An unwanted experience shows up, and I have to sort of engage in this rigid, repetitive behavior to try to reduce or control. Whereas psychological flexibility is like when an experience shows up, I can act flexibly. I can do different things. I can explore my values. I can be present. I can, it's not this like rigid pattern. And so ACT
Mm.
teaches people how to be a bit more flexible, how to be more present, how to be focused on the things that are important to them, and show up in different and perhaps more helpful ways.
Yeah, fantastic. Okay, and I have another question for you. A lot of the time, people with OCD can really struggle with recognizing, no, when they are actually caught up in a compulsion. How to know whether it's actually a compulsion, and it can be so confusing because this is the very nature of OCD. It's laying traps for us.
Yeah.
It kind of knows the kind of things to suggestions or ideas or thoughts to kind of to give people, because OCD is coming from you. It kind of knows the things that are emotionally important to you. And I don't know, with certainly for me, when I'm really triggered, I may know that something doesn't make sense or that I don't need to worry about that thing on one level, but on another level, there's still this pull and this kind of demand that I try to figure it out. I try to have certainty about it. And I feel like that is one of the hardest things in OCD. Um, how would you bring ACT to that kind of thing?
Yeah. Well, first off, it makes sense, right? It makes sense that the OCD would pick at something that's meaningful to you, because we don't tend to have anxiety about things we don't care about, right? And so it does sniff out the person's values and
Yeah,
really pick
yeah,
at like what matters to them deeply. And
yeah,
and and there's no cure per se, right? Because the only way I can think about how we could make that experience go away would also mean making the value go away too.
yeah, yeah. That's a really good point. Yeah,
So, for example, sometimes I work with mamas with postpartum OCD, right? And their OCD is focused on harming their child, and of course, like OCD is going to focus on their love and safety of their new baby, because that's what's most important, most meaningful to them in that moment. And really, the
yeah,
only way to make that fear go away is to also make the value of that love and safety go away for that child.
yeah,
I don't know many folks that would take that bargain, that would take that deal, right? And
yeah,
so what I often talk about is, you know, let's learn how to embrace it. Let's say bring it on, right? Let's say I'm willing to have you fear.
Mm.
When I say fear, I mean physical sensations in the body, right?
Yeah.
Every emotion is linked to a physical sensation in the body. So let's
Mm.
get good at being in our bodies, having those feelings while recognizing that some of the cognitive processes or the behavioral, like the mental compulsions or the physical compulsions, are probably not as helpful.
Yeah.
So
Yeah.
learning sort of like a new way to interact with the fear rather than, having to check the baby multiple times or even, avoid the baby. Can we do something like stand at a loving distance from the baby, observe the baby and face the fear and the feelings of like not knowing if harm or something terrible will happen and that it's okay to be scared.
Yeah.
Right?
Absolutely.
It's okay that
Yeah.
we all feel scared sometimes. Um, and it's a beautiful reminder of what's actually important to us.
Yeah. Yeah, that's a really great way of putting it. And yeah, I think it's important to keep that in mind that actually, if you were to just remove the fears altogether, well, that's removing a part of you. And, then you wouldn't be you anymore. And that defeats the whole purpose of it. So, yeah, absolutely. I really agree with the point that you're making there with that.
Yeah, sometimes I like to sort of refer to the OCD as almost like kind of the Energizer Bunny. It's just like it's reminding us of those things that are important, but yet it's doing it in a way that's like loud and excessive and unhelpful, right?
Yeah. Yeah.
Um, but if we're able to kind of acknowledge it and like say, I see you, I see you saying that these awful things may happen. And I don't know, but thanks for the reminder of what's actually important to me. But I'm going to do this in a different way, right? I'm not going to engage in the compulsions. I'm going to do something different, something that's a little bit more loving and kind and
Yeah.
focused on values.
Okay, fantastic. That's great. Thank you for that. And for people listening who who are really enjoying this and finding it helpful and recognizing that they struggle with some of this. If they are struggling, maybe they recognize that they're caught up in a thought. They want to apply some diffusion techniques. Could you give us a couple of helpful diffusion techniques that you talk about in the book, perhaps, or
Yeah.
yeah,
Yeah. So, I mean, one technique is sort of just adding language before the actual obsession. So, for example, I'm noticing I'm having the thought that X, Y, and Z might happen, or I may be a bad person, right? I'm having the thought that I'm noticing the thought that some people like to name their OCD. So I'm
mm,
noticing Bob telling me that, right? What this does, it literally puts a little bit of distance between us and our thoughts, which can help
mm,
us again go into that observer stance
yeah,
and make a decision around, okay, how do we want to proceed? So you can try one of those. I like to take the naming it a step further and kind of externalizing it a bit, right? So if you
okay,
could imagine like your OCD sitting in front of you, right? What would it look like?
okay, yeah, yeah, yeah,
Right? Would it take like a human shape? Would it take an animal shape? Would it be just a blob? Would it have eyes? What color would it look like? What would its voice sound like?
yeah,
Right? And I
yeah,
want you to just kind of, imagine it shrinking into the palm of your hand and sitting on your shoulder. And this week, as you go about your week, I just want you to notice, whatever you've named it. Bob apparently is today, sitting on your shoulder. And I want you to just notice when Bob has something to say to you this
yeah,
week.
yeah, yeah. Yeah, that's a great technique. I think I often use Dave for my own personal OCD, and I find that personifying it in that way, um, and almost trying to bring a bit of comedy to that, making fun of Dave a little bit, giving him a bit of a hard time. Not just taking everything he says at face value, being a bit ironic with him, can be really really helpful.
Absolutely. For some people, and this kind of ties into what we were talking about earlier, even thanking him, right? Like,
Yeah.
thanks for that thought, Dave. We'll see, right? Or
Yeah.
thanks for that thought, Dave. I'm going to go about this my way,
Yeah.
right? Just
Yeah.
simply that acknowledgement.
Yeah. Absolutely. Something else that you focus in on in your therapy now is perfectionism. And I'm quite interested in the concept of maladaptive perfectionism. So could you tell us a little bit about perfectionism, maybe how that relates to OCD?
Absolutely. So I kind of think of perfectionism as the cousin to OCD, if you will. Not everyone with OCD has perfectionism, and not everyone with perfectionism has OCD. But it is typically associated, especially maladaptive perfectionism is
Mm.
associated with anxiety as
Yeah.
well as burnout.
Yeah.
And so, and burnout can look a little bit different for everyone, but for some people, it turns into depression.
Yeah.
um, and so I like to think of perfectionism as putting a significant amount of energy in one area of your life while sacrificing other areas,
Right.
right? And so I think of like we have all these baskets in our life that we want to fulfill. So for example, our social relationships, our work roles, our personal hobbies, our family relationships, right? So we have all of these different baskets that give us value and meaning in life. However, perfectionism tends to like focus on one, maybe two or three of these baskets while sacrificing other things. And sometimes the sacrifice is more personal and focused on that person and sacrificing their own well-being. And
Yeah.
other times, the sacrifice is their personal relationships because they spend so much time on work. But what perfectionism often sounds like is you should be bigger, better, more different in some way, right?
Yeah.
Or what you've done or how you feel should be bigger, better, more different in some way, right?
Mm.
I like to think of perfectionism as like, the standards that are set are at like 110% for
Yeah.
folks with perfectionism. And most people are actually functioning at 60.
Mm. Yeah. Okay.
Right?
Okay.
And
There's a
so
big difference then.
there's a big difference, right? It's again like kind of related to the anxiety. It's like I have to put in all this energy and I have to do it now, right? And so we want to notice the amount of energy that's being put into
Mm.
stuff,
Yeah.
right? And learn how to dial it back from 110 to 60.
Yeah. Yeah.
It's not
Yeah.
all bad, right? Like for a lot of people, their perfectionism has perhaps helped them become successful in life in
Yeah.
certain circumstances, right? In certain contexts, in certain
Yeah.
places.
Absolutely. Yeah.
It's helpful. So it's not something you necessarily want to get rid of, but it's more so just dialing it back and being able to reserve some of that energy for some of these other baskets that are important in
Yeah.
life as well. And
Absolutely.
and again, like similar to OCD, in the short term, that can feel uncomfortable because you're going to have thoughts that you're not doing it right or things need to be completed. It's not good enough. So, in the short term, it's going to bring up those uncomfortable thoughts and urges to do things now and big.
Yeah.
Um, but values based living, again, is about the long game. So, we want you to basically be able to sustain what you love doing in the long term
Yeah. Yeah.
rather than putting in so much energy and then getting burnt out that you have to take a week off of work or you're spending the whole weekend in bed watching Netflix, right? Because
Yeah.
there's so much burnout. That's not living, that's surviving.
Yeah, absolutely. Yeah, I know personally for me, I have to go and do physical activity. If I'm doing a lot of mental work, if I'm coaching people and I'm writing or I'm doing podcasts, then I need to burn off energy. I need to move my body. And when I do that, that really helps and it kind of hits the reset button. I'm able to focus better afterwards. I'm able to, you know, whatever I was doing, I'm able to do it maybe 10, 20% better than I was when I was just sat there for 4 hours, working on one particular thing and not letting it go. But, the quality of the work was maybe decreasing every 10 minutes because I wasn't giving myself a break. but you go and spend some time with your family, or you go and do some exercise, or you go and do something else. Maybe you come back to it and you're in a better headspace, right?
Yeah. And that's the irony of perfectionism, right? It's so focused on a successful outcome, but really like putting so much energy into something actually reduces or diminishes the quality of it.
Yeah.
And
Yeah.
so sometimes less is more, and taking breaks and refueling in other ways
Yeah.
can actually be more helpful, though it can be hard to get up out of that chair and do something different.
Yeah. Yeah. Okay. And here's a question about self as context. An obvious way of building that now is through maybe a meditation practice or something like that, where you become a bit more of the observer. Now, become an observing self. You're observing the breath, perhaps. But I think with meditation, sometimes for people with OCD, it's not always necessarily the best thing. I don't know if you what your thoughts are on that, but I think sometimes when people try to close their eyes and just focus in on their breath, they can get a lot more intrusive thoughts. They can find it very hard to focus, and it can end up feeling frustrating. So, do you have any tips on how people can develop that self as context?
Yeah, that's that's a really, really great question. Because you're right, it's not uncommon for some folks that are already really inwardly focused for that to actually not be helpful. And so, I mean, I think, one of the ways that you could think about it as, I'm thinking about, there's a little exercise that one of my colleagues does that I love, and I've used it with clients at times, where you could literally just write your thoughts and experiences down on these like pieces of paper, right? And just kind of, I had one client who created a little mock TV screen. So he like cut out a little frame that looked
Oh,
like a
wow.
little TV screen, and anytime he had like an unwanted thought or experience, he would literally write it on a piece of paper, put it behind the screen, and look at it and be like, "Okay, this is my experience, and yet the me here is noticing it on the TV."
Yeah.
Right? And
Yeah.
so, you could even do things like picturing it being on a billboard, right? You're in the movie theater. There you are in the movie theater, and here is on the screen, like, what would we title this movie right now?
Okay. Yeah. Yeah.
And notice that there's a part of you sitting in the chair just simply watching the screen. And
Yeah.
we can do that with our eyes open, with more of like that outward focus. You
Yeah.
know, you could even go to a local park or a local beach and notice water, right? And notice what it's like to like literally just throw a rock in that water, representing one of the thoughts that you have.
Yeah.
And that there you are watching your thought, go into the ocean, and notice what that's like.
Yeah.
Right. So
That's great.
a lot of the self as context, like experiential exercises, don't have to necessarily be done eyes closed. Like, you could very well keep your eyes open. And the idea is to simply step back and notice the experience from a distance. So, can I imagine myself just pulling that thought up out of my mind, placing it on the cloud I see right now in front of me? And let
Yeah.
me just notice what it's like to watch that cloud float away.
Yeah. 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 That's great. That's great. That's really important. I think that people recognize that you don't have to just sit there and meditate. There's other ways, to develop that self as context. It also reminds me a little bit of a Russ Harris activity. There, I think he has one where he encourages people to either use an actual laptop and write down the thought on the word processor, and then change the font, change the size, change the color, put space between the letters, with the idea being to just see that these are just words. They're not actually meaningful. They're not really significant. It's just in that moment our emotions are high, and therefore we're giving much more significance to them than we need to.
Right. Right. Yeah, and kind of noticing what it's like to just notice the words being on your screen versus in here.
Yeah. Yeah.
right? That there's a part of you that's able to step back and just simply notice that and notice what that is like.
Yeah. Yeah.
Yeah.
Yeah. Fantastic. And what about simple techniques? Because I feel like a big part of ACT is really learning how to stop thinking about things that you aren't helping you, or to let go of things that aren't helping you, but without doing this thing that most people automatically do when it comes to things that we don't want to think about. We're told perhaps by people, if you have something that you don't want to think about it, well, just don't think about it. Just get rid of it, push it away, and get back on with your life. And of course, that just tends to make things worse, because what we push away tends to rebound twice as strong. Um, how does ACT combat that?
Yeah, good question, right? I mean, we can play with this right now. Whatever you do right now, don't think of a green banana. Don't think of a green banana, right? And what happens?
Straight up into my head, literally
It
the moment you
pops.
said
Yeah,
it.
exactly,
Yeah.
exactly. And so, and even for those people that were like, I didn't think about a green banana. Well, what happened the minute you decided to say, I didn't think about a green banana?
Yeah.
Right? The green banana pops up.
Yeah.
So we don't have control over those initial, springings of the mind, if you will. Like, we don't have control over the initial thoughts and images that come to us and come to our mind.
Yeah.
What we do have control over is slowing down, noticing when we're hooked in the mind. And when we notice that we're hooked on something that's probably not helpful, then we have a choice to, like, again, say, do we want to continue to spiral into that and avoid that green banana? Or could we kind of welcome it in and just notice what happens? Right. And
Mm.
when I say welcome it in, I think there's a distinction between, observing and ruminating, which I often, get asked is like, well, isn't that ruminating? um,
Yeah.
but no, because really what I'm saying is we're going to welcome in your fear, right?
Mm.
Not
Yeah.
just the obsession, but really like what's the potential worst case scenario that can come of this? Because
Mm.
typically folks avoid that.
Yeah. Yeah. Yeah.
Right. So we're going to welcome in that big, scary bully that's underneath the obsession, perhaps, and saying, you know what, I see you. I feel you, fear. I get what you're saying.
Mm.
And
Yeah.
lean into a bit of the uncertainty. I'm a big uncertainty fan of saying, like, I don't actually know what is going to happen or what may happen or the answer to this question, but I'm willing to take the risk in the service of what?
Mm.
Being
Yeah.
present now, moving towards those values.
Mm. Yeah.
Right?
Yeah. Yeah.
So, you know, it's the irony of that, like, we are programmed to avoid uncomfortable situations and uncomfortable thoughts and uncomfortable feelings. That's just
Mm.
how we are programmed from an evolutionary perspective. In the same way, if we touch fire, our hands will jerk back for most of us, right? And
Yeah.
so, same with uncomfortable thoughts and uncomfortable feelings. However, what we know is that in OCD, in anxiety disorders, avoidance is not helpful. It is food for the anxiety and OCD.
Yeah. Yeah.
So we really need to welcome in the underlying fear and the feelings. And although that does produce short term discomfort, what we know in the long term, by welcoming it in, you actually get better at having them. So when they show up in your life, when you're out living, you don't get so thrown off your game. You're like, oh, there you are. I've had practice having you, and I see you. And now I'm going to
Yeah.
go back to being present in my life.
Yeah.
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 But you've had that practice by going there, by doing exposures.
Yeah. Absolutely. And I think that's a really, really important thing at the heart of ACT. No, so thank you for sharing that. That's really great.
Absolutely.
Yeah. So we're beginning to run out of time. If you only had one piece of advice that you were going to give to people who might be struggling with OCD, what would that advice be?
It would be to be kind to yourself. It would be to be kind to yourself. The goal is not to get rid of all anxiety, all avoidance. We all have anxiety, some more than others. But even with OCD, the goal is not for you to never avoid or never engage in compulsions. I don't think that's realistic. We all do some avoidance sometimes, right? And so when you have a tough experience and you engage in a compulsion, that's an opportunity, like, that's suffering right there. If you're doing a compulsion, you're suffering, you're feeling scared, you're feeling anxious, right? That's an opportunity to give yourself lots of love and compassion,
Mm, yeah, yeah, absolutely.
right? In the same way as if a child came up to you with a bloody knee, you'd probably lean down to them and say, "Are you okay? Do you need me to rub this off for you? Do you need me to, a band-aid?" Right? In that same way, give yourself that kind of love and compassion and ask, "What are you genuinely needing?"
Yeah, yeah, yeah. That's so important to ask that question. And actually, what one more question, similar to that in a way, because another big part of the process of dealing with OCD is setbacks. And I guess kindness is definitely related to this as well. Um, what can people do when they have the inevitable roadblocks, those setbacks along the way of dealing with OCD?
Yes. So, it's not a matter of if you will fail. You will fail. You
Yeah,
will fail. We all do. It's a normal part of being a human being.
yeah.
Right? The only thing you have control over is when you do fail, how you treat yourself. And I want you to notice for yourself when you beat on yourself for engaging in compulsions, is it helpful? Does it help you move on? Does it motivate you to do exposures in the future? Does it motivate you to live your values? Right? What I notice for most folks is that it actually leads to feeling depressed on top of feeling anxious.
Mm, absolutely. Yeah, the judgment on top of a situation where you're already struggling.
Exactly. It's like, hitting yourself when you're already down, right? So it's in those moments that we actually need extra love and extra kindness. And so I love practicing mindful self-compassion. I've also taken a lot of trainings from Paul Gilbert on compassion focused therapy as well. And so I teach a lot of the folks that I work with different strategies on how to be more kind and loving to themselves when they're down, when they're failing, when they've engaged in compulsions. And again, it's less about beating yourself up. It's more about looking forward,
Mm,
right? What can I do today or tomorrow to get closer to what's important to me?
yeah,
Right. Rather than beating yourself up, what can I do today or tomorrow? That's itty bitty, doesn't have to be huge.
yeah.
To get closer to what's important to me.
Yeah, to get back. Yeah,
Exactly.
absolutely. Yeah, yeah. Having a bit more of a growth mindset, I guess, could be another way of putting it.
Yes, absolutely.
Yeah. Fantastic. Marisa, thank you so much. It's been wonderful talking to you. And if people want to find out more about you, about your books, what can they do?
Absolutely. Yeah. So you can check out my website at choicetherapy.net. We offer individual therapy, group therapy to folks located in California and Oregon. We do offer a support group that anyone can attend internationally. I also offer trainings for therapists and helping them learn how to help people with OCD. And you can find all of that information on our website, choicetherapy.net.
Fantastic. And the book?
Oh, the ACT workbook for OCD is also on my website. You can also find it on Amazon as well.
Yeah,
Mhm.
fantastic. Okay, well, yeah, thank you very much. It's been great talking to you. I'm sure the listeners have found it really helpful.
Thank you so much for having me.
This video is for educational purposes only and is not a substitute for professional mental health advice, diagnosis, or treatment. If you are dealing with OCD, anxiety, or any mental health concerns, please consult a licensed mental health professional for support.